All right, welcome everybody. I am John Haig. I'm the director of the Mostafa Rahmani Center for Business and Government. And I must confess right at the start that healthcare is not my area of expertise. Um, but I feel extremely fortunate. And, I was talking to David and James that um, I was looking through the write-up on what this session was about. And I introduce a lot of seminars, lunch seminars. And this one I actually looked at and I said, this is really interesting. And I think I will learn a lot at this session. The title is Three Tumultuous Presidencies That Rocked American Healthcare and Politics. It will cover the evolution of healthcare in the United States. And it's a mixture of an historian and a doctor with I will note an MPP, which I'll talk about here in a second, and not only an MPP but a Kennedy School MPP. So there's a lot to talk about and a lot to learn. I'm looking forward to it. So a little bit of background: David Blumenthal, MD, MPP. He's a professor of practice at the Public Health and Health Policy at the Chan School, the Harvard Chan School of Public Health. He's also a research fellow here at the Kennedy School. He is also the Samuel O. Thier, did I pronounce that correctly? Professor of Medicine Emeritus at Harvard Medical School. From 2013 to 2023, he was president and CEO of the Commonwealth Fund. And the Commonwealth Fund is a healthcare philanthropy based in New York City, and it had the mission of improving and functioning of the U.S. healthcare system. Um, there's a lot more I could go through. He was what I find interesting is my primary care physician at Mass General Brigham just let me know that he's retiring. David was a primary care physician, so I may turn to him at MGH. I may turn to him at some point on that front. He's a member of the National Academy of Medicine. He's an editor on the editorial board of the New England Journal of Medicine. And he's a new journal of the New England Journal AI, which that I may have something I want to talk to him about it.
Delighted.
So anyhow, so I want to thank David for doing this. And by the way, we're here. We typically don't do book talks as a kind of principle of the school. So we're not officially talking about their book, but informally,
Right.
the whole thing is about the book. Okay. And at the end, we'll raffle off 5 books and you can get them to sign the books. James Monroe, he's the John Hazen White Professor of Political Science and Public Policy at Brown University, and he's the co-director of the Stone Inequality Initiative. I don't know how many of you are aware that the Stone family has been quite generous with the Kennedy School as well. He grew up in, of all places, Rio de Janeiro, which you would not guess that. I wouldn't anyhow. Went to Middlebury College, PhD at University of Chicago. I'll be curious if the kind of Friedman-esque view of the world and the Chicago view of the world has filtered into his thinking. Published 11 books, almost 200 essays ranging from American history to healthcare policy to, this one I wasn't sure of. I was trying to figure this out. Harry Potter. Um, okay. And he's a member of the National Academy of Sciences, Engineering, and Medicine, and has been president of the New England Political Science Association and the Politics and History section of the American Political Science Association. So with that, I will turn it over to the two of them, and I'm looking forward to learning a lot today. Thank you for coming.
Well, thank you for having us. I had to say, giving a talk here at the Kennedy School, I have to make a personal reference. As John said, I was a graduate. I am a graduate of the Master's in Public Policy program back in the Neolithic era, and we wouldn't have written this. I wouldn't have been participating in writing this book. And I'm not going to talk about the book, but we will talk about the book. If it had not been for being at the Kennedy School, I also was on the faculty here for 7 years. And two things about my experience heavily influenced my thinking. And I roped Jim into doing the first book and then dragged him into doing the second book, but more easily the second time. And that was the, first of all, the influence of Richard Neustadt, who some of you may know. He's before your time, the late Richard Neustadt, founder of the Kennedy School, and one of my professors and one of my mentors. And he was the dean of the presidential studies and a great innovator in that realm. Jim tells me it has now gone out of favor or out of style in political science to write about presidents, but it was my affection and his example that led me to ask the question whether presidents are a worthy subject of study when you're trying to understand healthcare and the developments in healthcare in the United States. And the other thing about this is that as we were going through the issues that arose during these last 3 presidencies, as I was looking at the COVID issue, I became increasingly convinced that it should not be viewed as a health issue, but as a national security issue. And that lens is so prevalent here, and something I was exposed to both in the MPP program and then as a lecturer on the faculty. Plus, Graham Allison was another of my mentors, and he and I actually discussed COVID as a national security threat. So just a little of sort of contextual, personal contextual background. Why did we do this work? It was first because we learned from the first book, so this is the second of 2 books Jim and I have written together on presidents and healthcare. The first came out in 2009, and it covered presidents from FDR to George W. Bush, and it convinced us that nothing important happens in healthcare without presidential leadership, and that had been under researched and understudied, and that after we finished that first book, stuff happened. And so we wanted to give the presidential perspective on that. We also saw that healthcare was no longer a siloed issue. It has become totally integrated into all the complex issues that trouble our country, including perceptions of government, perceptions of authority, anger at expertise and science, culture wars, and that therefore healthcare has become a lens on the health of the country in ways that were not true nearly so much before the last 3 presidents. So I'm going to stop there and let Jim take over a little bit.
Let me illustrate the last point that David made. From our first president, when Barack Obama was about to run for president, there was one strong opponent to the whole idea, and that was Michelle Obama. And Barack's advisors, led by David Axelrod, said, look, this isn't going to work unless she's on board. And Michelle said, I'm a strong no. You got a family. And they finally all came to a meeting, all the advisors, and Michelle sat down across the table from Barack and said, all right, Barack, convince me. Why should you be president? And Barack said, I know one thing, that when I raise my hand to take the oath of office, there are a whole lot of kids in the United States, Black kids, brown kids, kids who've been left behind, who will suddenly feel different about themselves just by looking at me being president. Valerie Jarrett, their old friend, writes in her book that her eyes teared up at that thought. And Michelle looks at him and says, oh, that's a really good answer. Okay, I'm in. To us, to most of us in this room, certainly to David and to me, that was an incredibly exciting moment, which suggested that there was a new America, a diverse, embracing the diversity of America. The Census Bureau had just made a very controversial prediction that this would become a majority-minority nation. And rather than worry about it, here this man running for president embraced it and embodied it. So a very exciting moment. And we thought this was a new America. It turns out not everyone agreed with us. And not soon after Obama is president, this man with orange hair started running from studio to studio saying he's not American, he's not Christian, he's not legitimate, he shouldn't be president, and he gathered a following. And suddenly you have this great battle, not just between Obama and Trump, but between two visions of America. And when Obama decided, against all advice, to make healthcare his signature issue, that great debate about the two Americas filtered in, that culture war filtered in to healthcare and hasn't left. So healthcare is now not just about healthcare, a good policy where we can debate and maybe compromise about what's the best way to cover Americans and design the healthcare system, but it's become an issue about what America is and who's an American. So, you know, if you're a political historian, that's very exciting. If you're a citizen, not so much. But this is very much what attracted me and us to the book, that it was both healthcare, which we've been discussing since David was here at the Kennedy School, and it's about America itself. So one of the great stories we tell, there's a number of stories we tell in the book, but one thing that's really arrested me is that the American system fought over coverage for 100 years. For 100 years, we have fought about national health insurance. If you know anything about healthcare, you know about that war. In 1912, running as the Bull Moose candidate, the Progressive Party candidate, former President Teddy Roosevelt proposed national health insurance. Big debate in the 19-teens. California actually had a referendum on it. New York, it went to the Assembly. The American Medical Association organized itself around opposing national health insurance. The debate was on. And the first book tells that story, The Heart of Power. And what we say in this book is that debate after 100 years is over, and no one noticed. 100 years of debating between Democrats and Republicans, and we want to suggest to you the debate is finished. And we'll come back to this, but just very briefly, it came to a head. Franklin Roosevelt had a liberal group of advisors who were desperate to take the Social Security Act that he had passed in 1935 and expand it to health insurance. But Roosevelt knew that he was not going to get that through Congress. All these conservative Democrats from the South sitting on the major committees like Senate Finance, they weren't going to do it. But by 1943, 44, Roosevelt realized he was about to win the war, World War II, and he needed another campaign. And he seems to, you never know with Roosevelt, but he seems to have alighted on national health insurance. He took his most trusted advisor, Sam Rosenman, and he asked Rosenman to write him a plan. Roosevelt died before the plan was ready, and Harry Truman inherited the plan. And Harry Truman comes to the White House. He's been to the White House 2 or 3 times. He's barely met Roosevelt. He's been chosen as vice president just a few months earlier. He hangs out on Capitol Hill, where he spent his earlier part of his career, and suddenly he's president and sitting there trying to figure out, am I going to drop an atom bomb? I'm going to have World War II going to end. Suddenly, this message comes from the grave. Here is Franklin Roosevelt's national health insurance, and he seized it as the cause of his life. And Democrats followed him. This is the last piece of the New Deal that hadn't passed. Every Democrat had to say he was going to rewire the healthcare system, or she had to rewire the healthcare system when they ran. Nobody ran as a Democrat and didn't try to rewire the healthcare system. And remarkably enough, in 2008, Obama thought he would give it a try. And he succeeded. It's an extraordinary story, this success. It was on the verge of death 3, 4, 5 times that Obama, really in acts of extraordinary presidential leadership, saved this plan again and again. Just to take one example, he had 60 votes in the Senate. And then in January, after both House and Senate had passed it, but they hadn't combined the 2 bills, and both House and Senate hated the other branch's bill, uh, running to fill Ted Kennedy, who had died, running to fill his Senate seat. A Republican, Scott Brown, came from nowhere and won. And his campaign issue was, I'm going to stop Obamacare. And now the Democrats didn't have 60 votes. They had 59, which meant when the House and Senate agreed on how they were going to combine their two bills, Scott Brown was standing there. No way, it wasn't going to happen. And Obama had to go before the House and say the only way forward is the House Democrats is to pass this bill that the Senate passed and that you hate for various reasons. It had lots of provisions that seemed too conservative to the House Democrats. And he had to look a lot of these Democrats in the eye and say, last year when you won, it looked like you had a great career in front of you. And now you know you vote for this bill and your career may very well be over. Indeed, 60 of them got wiped out, including several that we know and talked to. But he told them that's what we're here for, not to sustain our careers. I may be a one-term president if this passes. We're here to try to make America a better place. Several of his advisors told us that it was the most extraordinary speech they'd ever heard. And when he left the room, the bill was ready to pass. And indeed, it did pass. But quite an extraordinary story that now we've got the foundations of complete coverage. If you include Medicaid, Medicare, the marketplaces, and employer health care, we can now get everybody covered by incremental means with fiddling with these programs rather than rewiring the whole healthcare system. Now, if you're sitting there thinking, I want single payer, fine, go for it. But we don't have to do that to get everybody covered. As Republicans push one way and Democrats push the other, the foundation is in place. And that is a really extraordinary story. And yet, no one noticed. No one today goes around thinking, wow, we actually got the foundations in place for various reasons, which we can talk about. David, you want to?
So there's a bunch of fascinating stories, he said humbly, in this book, which we're not talking about. And another one that was particularly fascinating to me as a physician is the COVID story. So when we started working on this, we thought we were going to write a book about coverage, mostly. And then this pandemic thing happened. Now, everyone in this room has a personal story about the pandemic, and many of us are living with the memory of that time in our lives. We constantly talk about before the pandemic and since the pandemic in our normal lives. But we were not, and I was not, a scholar of pandemics and the dynamics of the epidemiology and the consequences of pandemics. But it turns out that they are history-altering events. In many ways that I could describe to you, pandemics have changed history in fundamental ways that have redirected the course of human events. We do not know yet whether this one will have done that, but it has one amazing story, and that is Operation Warp Speed. Never before in the history of human events have we discovered a new deadly pathogen that is killing tens of thousands of people as we watch. And within a year of identifying the illness, developed a 95% effective vaccines that stopped the pandemic in its tracks. Not to say we aren't still seeing COVID, not to say we aren't still seeing people die of COVID, but it is now an endemic, manageable infection. That was 11 months. 11 months from the time it was discovered till its RNA sequence was typed. Within weeks of its discovery, there was a incipient vaccine available. That's by the way, a Tony Fauci story. It was his group that shared that vaccine with Moderna that went ahead to manufacture it. So that is an epical event. That vaccine saved millions of lives. And if you think of this as a presidential issue, and President Trump was instrumental in making this possible, I don't know of many presidents who can say that they did something that saved millions of lives. He gets very little credit for it because he can't talk about it. He can't talk about it because of the way he treated science in his campaign and how that, and FDA, and how that ramified through his base, creating the anti-vaccine sentiment that we now see and enabling RFK's reign in Washington. But that, to me, was one of the most fascinating stories. And there is a really interesting contrast between how Trump managed COVID, Operation Warp Speed, and how President Obama failed to manage the marketplace, the technology behind the marketplaces. Some of you will remember the healthcare.gov fiasco, which became emblematic of the implementation of the Affordable Care Act. Trump worked, and his people, not just him, worked closely with the private sector throughout the development of the vaccine. Obama and his people did not work at all with the private sector. And in both cases, the expertise to make the website work and to make the vaccine effective lay in the private sector. But a traditional suspicion of government inhibited Obama and his people from doing what they needed to do to get the website. Business, I'm sorry. Inhibited the Democrats from working effectively with the private sector, whereas Trump was willing to give pharmaceutical companies a blank check, which he did. So I think that's a really, and we could talk more about the lessons for government in the modern age where science and technology can make or break a presidency and make or break a country. How the COVID experience teaches and the Affordable Care Act experience teach lessons about effective governmental management of technology projects. And a Center on Business and Government, I think it's a highly relevant story and set of examples.
Let me pick up on two of these things. One is the implementation, since we're at the Kennedy School, the implementation of the Affordable Care Act, which was, another untold story, incredibly successful. There were 1,500 something secretary shalls in the legislation, which means that there had to be 1,500 something rules and regulations written. Now, those of you who study implementation know it takes 2-3 years often to write a rule or a regulation, but they only had 3 years to get the whole thing up and running. And so they set up a quite extraordinary process in which every principal got into the room at the same time. They had one day and they all hashed out the rule. And so rather than moving from office to office at the pace of Washington, D.C., it just flew right through. Most people who were involved in the process, most people who observed the process, most people who studied the process said they've never seen anything like that. An incredible success story. But no one knows that story for a very good reason that David just mentioned. That when it came time to sign up, everybody's sitting there. You got to see the picture. Everybody's sitting there and they see millions of people are going to the website and they start to cheer. Millions of people. That's what we were hoping for. And only six on the first day managed to sign up for a plan. It just crashed. Now, part of it, as David said, was they refused to work. They just didn't think to work with the private sector. But there's something else that was going on that has to do with the rules that the federal government operates under. The rules of hiring someone to do something like a website take, 3 years. You've got to put out regs, you got to do draft regs, you got to do final regs, you got to put it out, you got to choose someone, then the people who are not chosen get to appeal, and then you have to work through the appeals, and finally you've got someone. Well, 3 years are up, and you only had 3 years to implement the thing. So they went with vendors who already had an ongoing relationship with the federal government. Only one problem. None of those vendors had any expertise in website development. So part of the problem was not just work with the private sector. It was you have to bust the rules. The rules made it simply, flatly impossible to build a website just following normal standard operating procedures. So Obama asked every 2 weeks, he got his people in and he'd say, okay, are we good on the website? And they had these vendors who didn't know what they were doing, creating websites. They had 6 or 7 of them. And it wasn't until it all blew up that Obama put together a surge team. There's all these young people who came to Washington without pay and fixed it. And that's what they should have done right at the start. Trump, who was so amenable to breaking the rules and doing it his way, actually blundered into success with Operation Warp Speed. I shouldn't have put it so cynically. I'm sorry. Actually had, as David said, a great, extraordinary success. So, lesson for people in the future: got to change those rules and how you implement things, as well as learn to work with the private sector. And maybe a word about why Trump got into the war on
Yeah,
science. We tell the story of Trump's COVID experience in 3 acts. First, just denial, it's going away, and then panic. There was a picture that really shook him up of a refrigerator truck outside Elmhurst Hospital, a hospital right near where he grew up in Queens. And they're just laying COVID bodies into that truck because the morgue has overflowed. And that really shook him up. There's some other incidents where suddenly everybody's panicking. You probably remember what it felt like in March of 2020 when suddenly, we hadn't quite figured out how this germ worked. But it was very scary. And then Trump was a typical executive. When the economics team fought with the health team, he told them, go into the room and figure it out and then come back and make a recommendation. Jared, go with them. And that's what they did. It worked as any executive would work. And then Debbie Birx, who was running the White House COVID response, we talked to her at great length. She'd been to David's class here. She ran a very careful model. It suggested by Memorial Day there would be 100,000 to 250,000, 240,000, I think, deaths in the United States. A shocking model. And it really had an all administration fire response. Trump shut down travel from China, shut down travel generally, endorsed 15 days. He can't shut anything down, but he endorsed shutting down, governors shutting things down for 15 days, then 30 more days. He was doing the kinds of things his health team had suggested, driven by this scary model. The economics team wasn't liking this. Fox News wasn't liking this. The people talking to Trump, his business associates weren't liking this. So his chair of the economic advisors ran up another model. And it said 26,000, I think, 26,000 deaths by Memorial Day. By the way, there had been, at the point this model came out, 31,000 deaths. But never mind that. Fox News announces there's a new model, only 26,000. Trump hears about the new model, 100 to 240 versus 26,000. And he knows the healthcare team has been messing with him. They've been contradicting him, and every time he suggests something on television, they roll their eyes. He's pissed off at them anyway. Sorry, I get too excited, and I lose my.
I'm the calm guy.
Yeah, I'm the coffee. So Trump turns. There's a story Debbie Birx tells. They're in the little room right outside the briefing room for the press, and he looms over her. She's actually frightened, physically frightened, and he says, "I will never listen to you again." And they go out, and that's it. He just shuts down the healthcare team. He brings in people who are going to do his kind of healthcare, who will say yes to him, and that's it for the healthcare team. And then he sees the pictures of people waving Trump flags and waving their guns and liberate Michigan. And he starts tweeting, yeah, I'm with them, liberate Michigan. And so he moves from listening to the scientists to finding scientists who will endorse what he wants. And what he wants is, this is just the flu. And then stage 3 of this conversion into an anti-scientist, he brags on his vaccine after he's lost the election at a rally, and his own people boo him. This is not a usual sight for him. He does it twice, and both times they boo. And he knows he's got to pirouette ahead of his own people and start talking down vaccines. So by the time he comes back on his second administration, he knows these health people were part of the deep state that were in to defeat him and wanted the Democrats back. And he tells Bobby Kennedy, go wild on healthcare, go wild on science. And Bobby Kennedy does. So it's a series of steps that lead Trump into the anti-science mood, the attack of his administration.
There's one particular story here that is particularly ironic. So because Trump understands, even though he won't say it publicly, how awful this disease is, he is constantly looking for a miracle cure. Bleach, sunlight, then there's hydroxychloroquine, then there's convalescent plasma. He convinces bullies and FDA first into approving some of these, and then they reverse their approvals as more data comes out showing they're not effective. And his response, and that of his people, is basically, you guys are out to get me. This is just politics. Those tweets, those attacks, so concern the vaccine manufacturers who want people to buy their vaccine and are afraid that the discrediting of FDA will reduce public confidence. 9 biopharmaceutical companies take out full-page ads in all the major newspapers saying that the FDA basically has to be allowed to do its job because these vaccines have to be established to be safe. So what the FDA does is they extend the time of the trial to make sure they pick up a safety signal if there's a problem. So instead of 60 days, they'll do 90 days. What does that do? It pushes the approval of vaccine until after Election Day. Well, it's clear to Trump that this was a political plan to defeat him. Whether he understood the pressure that vaccine makers were under, the value of safety data, who knows? But it kind of sealed the deal that organized science and the institutions that represent it in the federal government are political, at base political. They're scientists, they're politicians in white coats. And I think that explains what Jim has just said, why we are seeing in the wake of this enormous triumph that he is responsible for, that saved millions upon lives, not to mention trillions of dollars in economic and healthcare costs. Suddenly, we've got an all-out war on science. It's about running for re-election and perceived opposition to him, personalized opposition from the FDA, who extended the trials so they wouldn't be done until after his election. So it's all predictable in retrospect, and also fits a pattern in American politics that Jim can talk about, which is anti-intellectualism in American politics.
And maybe I'll talk about the war on poverty, and then you can talk about the next epidemic, and then we'll turn to questions. But there is a tradition in the United States of populist anti-elitism, vivid from years ago. The Andrew Jackson administration came to power. Andrew Jackson touting any man can do the job. He cleared out the federal government of experts and brought in rotation in office. And medicine was very much part of that. While the Europeans are developing scientific establishments, Americans in the 1830s are tearing theirs down. This is a recurring theme that science and expertise develops in the United States, and then tides of anger, that a populist anger against it. Now, the latest variation of this, coming out of World War II, completely bipartisan, highly respected scientific establishment. But what we're seeing is something that has happened before. of these tides of populism. The point about these tides is they always recede. Facts are stubborn things, and you can talk down vaccines all you want, but vaccines are necessary to protect modern societies, and you can only swim against the tide of reality so long. So if you look at the past, these great populist, anti-expert movements, they always recede. And David and I are I believe that this one has probably peaked. More on that in future writing. But two more things to say, and then we'll turn to your questions. One other thing that happened in the early Biden years, we think of Biden, and no one can forget that picture of the old man in the debate. But those first 2 years of the Biden administration were terrifically successful. In his first 100 days, he got 200 million vaccines out, which was a kind of mobilization by government, rarely equaled. 200 million vaccines, which was kind of that was the real liberation day for many Americans. Suddenly you could travel again. And the Nancy Pelosi with Trump and then Biden created a quite successful war on poverty, an unprecedented war on poverty in the United States. There's an old cliche that conservatives are fond of, that in the 1960s, America declared a war on poverty and poverty won. Well, not this time. This time, there was a terrifically successful set of programs that brought millions of people in the United States under the umbrella of COVID out of poverty. To take just one example among very many, child poverty in the United States, thanks to the Earned Income Tax Credit, which was revised so that parents were simply sent checks rather than running it through the tax system, took American childhood poverty from the rates that are typical of countries like Mexico. Our child poverty rate and the Mexican child poverty rate are almost indistinguishable. And for 2 years equaled the rates of Switzerland and Germany. Very successful countries with very low child poverty rates. It was really almost miraculous to see that happen. And then when they tried to keep those plans in place, they could only get 49 votes. 49 votes. Joe Manchin said no. They couldn't get to the 50th and the 51st vote. And so it all receded. And in my view, in our view, that really helped mess things up for the Democrats when they were running. People had this memory that the economy used to be great. No, it wasn't the economy, it was the welfare state. They were getting lots of money to get through the COVID experience. For a little while, we really approached the kind of social democratic ideals that a lot of liberals and progressives had hoped for. 95 people on Medicaid, another 21 million on the Affordable Care Act marketplaces. With rules and regulations, suddenly we were beginning to approach universal health care. And then, of course, the votes weren't there, it all receded, and people barely remembered that we had really a quite successful welfare state. But if you study these things and are waiting for the opportunity, the plans and the successful programs are there to be studied and to figure out what worked, what didn't work, what can be done in the future. So in a way that wasn't true before the early Biden administration, before the early 2020s, progressives have a road plan for the future. Things to study, things to learn from that they've never had before. The most successful war on poverty, as I say, since the New Deal. But there's COVID coming again.
So, John, I think you know which side of the Milton Friedman divide Jim is on.
I was there when he was there. We thought he was a kook, and then he changed the world.
So pandemics create dread and damage, and they also create opportunity. The Great Plague in the 14th century ended feudalism. The Great Influenza in 1918 was responsible in no small part for the Versailles Treaty. that so penalized Germany that it resulted in World War II and all the consequences of World War II that we're living with as we speak, with NATO still a reaction to it. So it creates so it creates opportunity and it creates damage. But in any case, it is devastating while it occurs. We are less prepared now for another COVID-like pandemic than we were in 2020. We are less prepared because the reactions that resulted from the animus against public health institutions, against vaccination, against science, the anti-expertise, anti-intellectual resurgence that we've seen has undermined all the institutions that protect us against pandemics. Pandemics are a national security threat. We need the kind of early warning systems for pandemic that we have for Russian and North Korean missiles. We need the kind of war planning and game planning that we have for taking over Cuba, fighting in Iran. You name the potential conflict, we've got a war game for it. We don't have anything like that for dealing with pandemics. And it very well, probably not in my lifetime, but very likely in some of your lifetimes, there will be a repetition of the COVID phenomenon. And we can only hope that we will be better prepared than we were before COVID, and we will have to change direction in order to do that. So let's stop here. We went a little longer than we intended, but you guys probably don't have any questions, so
Yeah.
we can keep going.
Yeah, if you don't, here's the threat. We'll just keep talking.
That's right. I think
Why don't you introduce yourselves before?
Really wonderful presentation.
we need to get you a mic
Oh,
so
here
that
it comes.
people online can hear.
Thank you.
Really fantastic presentation. My name is Justin Smith. I'm a third year Doctor of Public Health student at the School of Public Health. I'm also a proud graduate of Brown University, where I had the
Hey.
opportunity to take your
I didn't think they
City
let the School of
politics.
Public Health students over here.
I took your city politics class about 22 years ago. So, you talked about that, there are these waves of anti-intellectualism that they sort of recede. From the lessons of history, what are some of the things that happen to accelerate that process? For those of us that are trying to get back to a more normal sense of how science and public health are viewed, what might be learned from history to help us do that in the present moment?
As I said, facts are stubborn. You can argue against expertise, but in the end, you do need expertise. So we're seeing this happen right now in real time. That Kennedy went crazy on science, went wild on science for a year, and then people began to read the public opinion polls. And it turns out that most people understand that vaccinating their children is really important. 90%, even most Republicans want to vaccinate their children. There are pockets where that's less true. And so that you begin to see this pushback. And we're now beginning to see the administration tell Kennedy, talk about food. People like your food story. But I think it is really a question of reality is malleable for a while. You can create your own reality, as Bush said about Iraq, as Trump has said about science, but you can't create your own reality forever. There are facts that as you don't vaccinate children, diseases that have been solved spread. And that's been true throughout history. You replace all your experts with people who are mere politicians, and suddenly the mail doesn't get delivered, and services that people need aren't being achieved, and so that you get a reaction. That as long as you have, and it's incredible that I have to say this, but as long as you have contested elections, people suffer when they stop producing the goods. And the Trump people are now very worried about the next two elections if they can't start, if people get more and more upset, one about the economy, but two about healthcare. So I think it's simple public reaction that's driving this response.
There's a reservoir of positive feeling towards science. It shows up in the polls. It can be mobilized, but it can also be blunted. And I think it's a matter of leadership, not just national leadership, but local leadership. So, and it's also a challenge for the scientific community to get out and be more public about what it has to offer, especially the economic benefits of science, which can be amazing um, when you have concentrations of science. So I'm optimistic because I think that, in fact, science and hope are very closely linked in people's psyche. But the pandemic extinguished the hope for a while, and now we can bring it back.
Yeah.
Hello, my name is Pantelis. I'm a first-year MPP student here at the Kennedy School. Thank you for your coming here today and giving this talk. My question is, can you speak a little bit more about the influence of poverty policy and healthcare policy, how they might be intertwined, how they can be distinguished? Thank you.
Well, as someone who studies healthcare and has provided healthcare, I was a primary care physician for 35 years at Mass General here in Boston. I find that poverty and economics and healthcare are inextricably linked. That many of the factors that make it hard to take care of people have to do with their level of affluence and the resources available to them. And multiple studies over a long period of time have demonstrated that. One of the reasons why we perform so poorly in the United States compared to other democracies in healthcare is because of the Gini index in the United States, the levels of inequality, which are only getting greater. Pandemics make it possible to do anti-poverty work in the guise of healthcare work. And that's one of the upsides of pandemics. In this country, though, it doesn't seem like there is an enduring commitment that extends beyond the exigency of a pandemic to dealing with those inequalities. So I think healthcare can only take you so far as a remedy for inequality. You want to add to that?
It's pretty extraordinary. If you look at the Gini index, which measures inequality among nations, the United States was between just slightly ahead of Japan, slightly behind France in 1970. And now we're nowhere near any. We've dropped entirely out of the European League, which has, by and large, since 1970, if not maintained its level of inequality, but only diminished slightly. We're much closer to the South American League now. We're closer to Brazil and to Mexico in terms of our levels of inequality. And as David just said, until we address that enormous sets of differences among the rich and the poor, healthcare can only do so much. It is interesting that the United States is 50th, roughly, depending on what measure you use, among countries in life expectancy at birth, among most indicators of population health among young people. But if you take 80-year-olds, we're pretty close to number one. That is, if you have a thoroughgoing social safety net for people, as people over 65 get, suddenly the differences begin to wash out. So we know what we need to do. And it's not just healthcare, it's part of a whole social welfare, as David said.
Actually, I've been working on a study that is not published yet that compares the health and healthcare of elderly Americans to those of 9 other countries, European and developed democracies. Our elderly have health and healthcare that's comparable to those countries. Why is that? 2 things: Medicare and Social Security. We have a safety net in Social Security, and we have universal coverage in healthcare. Our healthcare system could function at the same level as other countries do if we had universal coverage and a reasonable social safety net.
And now Milton Friedman is rolling in his grave.
That's right.
Thank you. My name is Carolina. I'm a MC, a mid-career master's candidate here. Thank you for your time. And you spoke a little bit about how difficult it was for the Obama administration to work with the private sector. And that was the main difference that you distinguished with the Trump administration. I'm wondering if you could speak about what can governments do to ease that collaboration in times where there are no crises? You spoke about the example of bringing people without pay to fix it, and I think that's very common also. I come from Paraguay. It was the same thing during the pandemic. We were asking people from the private sector to come without pay, but that shouldn't be the case. There should be a more, I believe, less frictionless or less friction in bringing the private sector in. Thank you.
Well, not my expertise, but I will tell you that it's a delicate dance. So I've worked in government at a senior level, and I've been the subject of accusations that I was basically corrupted by the private sector. Front page Washington Post when it was still meaningful to be on the front page of a newspaper. Totally fallacious, but I think it shows how problematic it is for government to work with the private sector, because this anti-intellectual trend that we've identified is really an anti-power trend. It is a pro-egalitarian trend and a suspicion of people with money and power, and a suspicion that government is inherently corrupt. So when you let the private sector work closely with government, you create opportunities for that perception. The rules that make it so hard to contract, and I ran a multi-billion-dollar program in the federal government in which contracting with the private sector was elementary, was critical. The process we had to go through was totally devoted to preventing corruption. And it worked. We had no problems with ethics during the Obama administration. And no one gives him any credit for that, but that was a fact. So I think that we could improve the contracting process, streamline it without creating corruption. But I do think that given the politics of our country and the suspicion we have of power, that it's going to be very hard to create outside of crisis the kinds of collaboration that was possible both in the Obama administration and in the Trump administration. So focusing on contracting, focusing on ethics, making it easier to do the right thing, I think would make it easier to work with the private sector.
And if you want to dream big, there's two barriers. David touched on both of them, but one barrier is just that it is so easy for politicians to bash government servants. And if you wanted to dream big, you dream of an era where public service is valued as it was in the 30s, as it was in the 60s, rather than bashed. And it seems like a stretch today because so many, particularly conservative politicians, just get the easy fix, the drug rush from bashing the bureaucracy. But that makes all what David just mentioned so much harder to do. And second, partisanship. It is so easy to get on the front page because the other side, whichever the side is, the other party is looking for ways to create scandals. Both parties do it. And partisanship has gotten to such a level that destroying people's careers to make points is part of the way the game is played. So somehow we need to get beyond both those, the intense government bashing and the intense partisanship that actually destroys individuals.
I think it's very nerdy and it's very unsexy, but paying close attention to the contracting process, streamlining it. I'll bet John, in his work at AT&T, had plenty of experience with that. It's hard to work with the government. It's hard on purpose, but it could be made easier if we re-examined the processes that are in place right now.
Hi, thank you both so much for being here. My name is Anchita, and I'm a dual MPP MBA student. And I've been interested in this idea that you keep talking about how politics are so intertwined with healthcare. And something I've been struggling with, so I don't know if you'll have a clean answer, is how we move forward when politics are so partisan and pushing forth healthcare policy. So thinking about how you mentioned single payer may not be a reality, but we may be able to move towards universal coverage. But it feels like in the past few years, we've been moving away from that, not towards that. So I guess I'm just curious what your thoughts are on like the future of healthcare reform in the current political climate and how we can maybe hope to see it go. Yeah, thank you.
I have answered that question a lot of times because I was one of the key healthcare advisors on the Obama campaign. David Cutler and I, David may be known to people here at the Kennedy School. So we were always asked about the single payer system, and Obama would have loved to have a single payer system, but he didn't think it was politically feasible. And I don't think it is yet. There's an economist, a venerable economist named Victor Fuchs, who passed away a few years ago, who was fond of saying that we'll get to single payer if we have another depression or a third world war. I thought maybe a pandemic would do it, but obviously not. So I think we've got what we are able to tolerate in this country politically, which is a combination of government programs for the elderly and the very poor, and market-based programs for everyone else, employer-sponsored insurance and the marketplace. It's a messy system. When we interviewed Obama about for the book, he readily acknowledged that it was not an ideal solution to the problem, but he didn't see an alternative. I worked for Ted Kennedy for early in my career, and I watched him as a lion of pro-coverage healthcare gradually retreat from the idea of single payer in the face of opposition. So we can streamline the insurance program we have now. There are European countries like the Netherlands and Germany that provide universal coverage fairly efficiently and equitably through private insurers. We can do that here. It means regulating private insurance, which we've been loath to do, but which the Affordable Care Act started. I will say that in case you get depressed about it, there are a dozen states or more in the United States that have levels of uninsurance that are comparable to Europe. And they've done it through Medicare, Medicaid, and the Affordable Care Act.
Starting with Massachusetts.
Yeah.
I slightly want to differ with this. I've never liked the Victor Fuchs quote. And that is, we always see just what's possible in front of us. Kennedy saw what was possible in front of him. Obama saw what was possible in front of him. And as David said, it wasn't possible. You couldn't get to 60 votes in the Senate. But that doesn't mean the future is completely written. There's two ways to go. The easy way, which is slightly expand incrementally what's already there. That's a big achievement. But that's not to say it's the only achievement. New possibilities will come up, and they come up in a way that David just implied. When Roosevelt looked around to figure out what he would do in the New Deal, the largest, biggest expansion of social welfare policy in American history, he didn't just make things out of his whole cloth. He looked at the states. Well, so Wisconsin has these laws about taking care of old people. Let's try that. Other states had laws taking care of mothers. Let's try that. The Social Security Act is a compilation of state laws. So when you think, gosh, I'd like to get to single payer, it's true. It's not possible now on the federal level. Kennedy discovered it wasn't possible. Obama discovered it wasn't possible. But I don't want to tell you it's not going to be possible 20 years from now. And the way to get there is to make things that you believe really good work on the state level. And as it works on the state level, the moment might come. Yeah, maybe it's war. Yeah, maybe it's depression. But there may be other circumstances that will lead it that we just don't see because we can't see the future. So the answer is work on the state level to make it happen and then start pushing it onto the federal level. And who knows? We, as David likes to say, may not be around to see it, but you may make it happen. Here you are at the Kennedy School. You'll be the leaders of the future. And I hope you get there from Massachusetts to Washington.